Young people want to be actively involved in shaping the future of our sexual and reproductive health rights. We need to be actively involved and empowered. We want the adults in our lives, such as parents and teachers, to support this need. Other vulnerable young people, like refugees and people living with disabilities, are also demanding a safe space where they can learn and discuss SRHR. My name is Theo, and this is Key Finding of Research by NWO-WOTRO to find out what youth need in terms of sexual and reproductive health. NWO-WOTRO have supported 12 research projects based in Bangladesh, Burundi and Jordan. These projects have worked with researchers based in both the Global North and the Global South. The research has a strong emphasis in supporting vulnerable youth, including young men and boys. The researchers have also worked with young female migrants, people living with disabilities, and youth affected by early marriage. Through their participatory research, those involved have empowered the young and vulnerable people they have worked with. They have heard a clear message that these groups must be involved to define the future SRHR policies they need. Throughout the project, researchers were encouraged to connect and learn from one another. Policy briefs and how-to guides were created to share research findings with policymakers so that the research could have a wide reach and inform future SRHR policy. If you want to learn more about any of the projects, you can visit the website. But let me tell you a little bit more about what some achieved. In Bangladesh, the Digital Sister Project listened to and aimed to provide middle-class youth living in urban areas with information they said was critical to their SRHR needs. For example, young people wanted to know how to get help if they are harassed online, and in response, this animation video was made. It is based on real-life experiences of the young people the project worked with and includes information from experts such as lawyers. The video effectively shares how to get help whilst bypassing the issues of stigma and shame felt by many young people around sexuality. As Burundi is a densely populated, poor and highly fragile country where almost half the population are below the age of 15, the 3 projects based there all focused on working with vulnerable youth. For example, women at risk of early childbearing, refugees, and those with disabilities. The projects worked with young people to find out how they navigate sexuality, how they are influenced, and how they can be empowered. We know that creative and inclusive methods that encourage open conversations on SRHR are essential to make positive change. In Jordan, the National Center for Culture and Arts Play, It Is Not Shameful, was developed by the Interactive Theatre Project. It dealt with many SRHR related topics and showed the negative impact of shame culture on young people's lives. The project found that talking about these issues through theatre stimulated debate and conversations about social preconceptions.
Sexual and reproductive health and rights was one of 5 priority areas of Dutch development policy. The Netherlands Ministry of Foreign Affairs established a knowledge platform on SRHR, ShareNet International, to identify knowledge gaps and enhance networking and knowledge sharing. Further, the Ministry funded the SRHR research program, developed and managed by NWO-WOTRO Science for Global Development. With the program, we aimed at delivering research results that could inform policymakers and practitioners to better address SRHR for youth and vulnerable populations. We therefore emphasized and supported engagement of researchers with the relevant parties in policy and practice and with the target populations from the inception of projects onwards. Some important questions were: what are barriers youth and vulnerable populations face in accessing SRHR information and services? And could we reach vulnerable groups on sexual and reproductive rights through more innovative ways?
So what did the research show us? Although each research project had different and detailed findings, each country had a general message emerging. Bangladesh. In designing effective interventions for youth, we need to create a safe space for youth which is reliable, accessible, anonymous, and sustainable. Burundi. Additional layers of challenges such as poverty, disability, and refugee status exposes youth to further vulnerability in SRHR. Enabling policy is important, but not sufficient in this fragile state. Parents and the wider community must take responsibility in supporting them too. Jordan. Youth and more vulnerable populations, like refugees and women not currently married, want to access essential SRHR information and services more, but have to be supported to do so. This needs to involve ministries, healthcare providers, and people around youth, such as their parents.
Some common themes highlighted by the research across the different environments and diverse projects were: youth often don't have the information they need regarding SRHR. This can put them in vulnerable positions. When young people can obtain information and services for their sexual and reproductive health safely, this empowers them to make their own decisions. And for programs focused on young people to achieve their goals, youth themselves must be involved, consulted, and empowered.
The message that we want you to take away is that youth and vulnerable populations are demanding a safe space that is reliable and accessible to learn and discuss SRHR. We want the key adults in our lives, such as teachers, parents, and health providers, to be supportive in our need. We also want to be actively involved in shaping future SRHR agenda.